This is Biobeat, brought to you by Biotechnology Board here in Pittsburgh, Pennsylvania, where we bring life-saving innovations to life. I'm Kanak, Iyer, co-founder of the board, and our mission is to make Pittsburgh a hub for global partnership in biotechnology. We recently hosted the first Pittsburgh Biotechnology Summit at Carnegie Science Center, where we brought bioengineering, biomedicine, and business of biotechnology leaders all together under one roof for the first time, and had elected leaders of the region together so we can create an ecosystem where biotechnology can flourish. And as I was just telling our co-host here, Bill Flanagan, that biotechnology is going to do for Pittsburgh in the future what steel did in the past. So that's where we are. So today we have some very special guests, and it is. Would you like to introduce them?
Sure, I can do that.
Yeah, go ahead.
Yeah, absolutely. Hi, I'm Bill Flanagan, so I am the facilitator of our conversation
Resident
today.
professor of history, who nobody knows Pittsburgh and the region as good as Bill Flanagan.
Well,
So
thank
Bill,
you.
take it
It's
away.
very kind of you to say. And we are called Biobeat, and we're talking about biotechnology and how that could remake Pittsburgh. But our focus today is a little more on artificial intelligence and AI. But with a little bit of a twist at the same time. And we could, with our two guests, go very deep and very technical. Pittsburgh was, after all, the birthplace of artificial intelligence, and Carnegie Mellon remains a global leader. But today we want to talk about kind of the personal impact this is having on all of us as individuals, our communities, and the world at large. And we're able to do it through the eyes of two scientists who have a very personal connection to the subject. Ramaya Krishnan is the Dean of the Heinz College of Information Systems and Public Policy at Carnegie Mellon University, and the William W. and Ruth F. Cooper Professor of Management Science and Information Systems. Rema Padman is Trustees Professor of Management Science and Healthcare Informatics, there's the healthcare connection, in the Heinz College, and Thrust Leader of Healthcare Informatics Research at iLab, and Research Area Director of Operation and Informatics at the Center for Health Analytics at the Heinz College, and they also happen to be married. So welcome. Good to have you both here and joining us for this conversation.
Thank you so much.
Yes.
This is a fan moment for me, Krishnan and Rema. You know, I am so honored that you are here for our podcast. And today happens to be Diwali, so happy Diwali. That is why we have the lamp for us and a little bit of the Indian diaspora here, creating an ambiance. So
Thank you very much.
And
thank you very
welcome
much
to
for having.
Biobeat.
Thank you for having us.
Yeah, and I want to get to AI, and I want to get to technology, and I want to talk about what we need to worry about and what we need to feel good about as we move into the future. But first, a little bit of your personal story. As I understand it, you both came to school here in the U.S. You met at the University of Texas. How did you find your way to Pittsburgh?
Hook 'em horns. We were in the Ph.D. program together in the same lab. Rema and I met as graduate students in 1983.
Now, you're from different parts of India, or
Different
did
parts
you grow
of
up
India.
down the street from
Neighbors,
each other?
neighbors.
Neighboring states,
Okay.
Neighboring
southwest and
states.
southeast India.
That's right. And we met in grad school at Texas, and she impressed me by being amazing on so many dimensions.
Oh,
that,
absolutely. Oh, my God. I can only imagine, you know.
Oh,
She's
it
just
was
an
the
awesome
rest is
person.
history. So that's
Yeah.
No, we met there. We had
children?
we had children here in Pittsburgh.
Yeah.
So
They're Pittsburghers.
So your
Yeah.
kids were growing up as burgers. I
yes,
love
very
it.
much so. They were both born here and studied here
Yes.
at Carnegie Mellon,
Right.
and are now working in New York.
Yeah.
So what brought you here to Pittsburgh in the first place, or after you got out of school?
Carnegie Mellon.
It was Carnegie Mellon.
it was
so
Carnegie Mellon. Yes.
Just were you recruited, or did you all know about it and want to find your way here?
Actually, I was fortunate. It's actually a small world. I mean, Bill Cooper, who was a legendary scholar who was one of the founders of what is today the Tepper School of Business. It was called Graduate School of
I
Industrial
remember
Administration.
GSIA. I remember those days
exactly.
on the
And
other side of
also
campus. Yeah.
Yeah, and he was the founding dean of what today is the Heinz College. So,
I
an
see.
amazing person.
Sure.
And he was a professor at the University of Texas. After in the mid '70s, he left CMU to go to Harvard and then to Texas. And I was fortunate to be a research assistant of his.
Wow.
And
What a
so
great
when I was completing my PhD, there were many opportunities on the table, but he did think CMU was special, and he was right that we should go here. So that's what led me here, and then Rema soon followed. And
Yeah, I joined, I finished PhD from UT Austin and joined the University of Minnesota at the Carlson School of Management.
Oh my goodness.
And then, we were trying to solve what we call the two-body problem.
Yeah, you had a distance relationship. That's tough. I
And
mean, I
then-
love Minnesota, but that's
Yes.
a haul to get back and forth, right?
And then we were fortunate to be able to solve the
Oh,
problem
wonderful, yeah.
when I moved to Carnegie Mellon.
Okay.
It's been
Excellent,
great.
excellent.
And that brought, you said Carnegie Mellon was the right place to be. Why? What was it that he saw here and he saw in you and you saw here that made this the place to start your career?
well, I think I can speak more to the experience that I've had
Okay.
here. So I think when I showed up, this is '88, I think within the first few months I got to meet Professor Herb Simon, who in many ways was quintessentially CMU in all manner of ways,
Among the fathers of artificial intelligence.
and the father of AI.
Yeah.
And my first PhD student was co-advised with Professor Simon, and I think he was remarkable in being both approachable, being able to work with somebody who was just a freshly minted PhD, but treated everybody around him with respect, and the low disciplinary boundaries at CMU, which Bill Cooper had spoken about, but you actually got to see that in action, because when I showed up at CMU, Professor Simon was actually in psychology. But he had appointments, of course, in computer science, and the work that we did together gave me every reason to believe that this was a place that was all that it was cracked up to be, which is that people work together. It was collaborative. You could work across boundaries, and people cared about solving big problems and challenging problems and making an impact. So all those lessons were learned very early. So I think Bill probably didn't quite articulate all that to me, but he said, go to CMU. And he had, of course, been here and was a colleague of Herb's for many years. So I think what he said, he was prescient. I think what he did say turned out to be the case, and CMU has been special in all sorts of ways.
Yeah, no. Well, I wonder for both of you, because you moved here. You had a nice opportunity up in Minnesota. I'm sure you could have made a wonderful career up there. Other than getting to be together and start a family, what doors has it opened for you professionally to be here in Pittsburgh and here at CMU? And then I'll ask Krishnan the same question.
Yeah, no, it's been an amazing journey here at CMU. I also was really lucky to have the opportunity to work with Professor Simon. We also co-advised a PhD student. And in fact, I met her at I was at the conference in Seattle, the Information Systems Operations Research Management Science. And she came there, and then we were reminiscing about, working with Professor Simon for her thesis work. And so it just, made it all very immediate. And I was very lucky to have that experience. And more than that, I think Heinz College has been a very supportive environment. So after once I got, my work was in operations research, operations management, and broadly across applications such as productions and, resource allocations and so on.
Yeah.
But once I received tenure, I thought I would like to change my field of application to healthcare, because in operations research and computer science, I've had very successful applications in healthcare. So I received funding from the National Institutes of Health to do a senior fellowship in applied informatics at the Pitt Medical School. So I think this combination, it was just down the road from CMU. And so having that opportunity to be embedded in the healthcare setting, the informatics setting, in the analytics setting, and healthcare IT and was just beginning to be discussed, not even having taken off. It was early 2000s, and within 10 years, we had this huge deployment of electronic health records. Data was being collected. Now we have informatics, analytics, operations, everything coming together. So this and that's really where my focus is, research and teaching. So I think this journey from Texas to Minnesota to Carnegie Mellon, has brought me to this place where I'm really, really passionate about what I'm doing and really excited about the opportunities that are available right now.
Well, it sounds like you both sort of stumbled in on the ground floor of enormous opportunities at Carnegie Mellon and in the AI space as well. How big a difference has it made for you, Krishnan, to have the opportunities you've had just intellectually and professionally here?
And also, if you would talk about your leadership, I've always admired your leadership. Because it's very complex, at that level, and how you have navigated, so to say. So if you can give some insights into for listeners, that would be very
sure.
helpful.
So, as Rema has noted, I think one of the things that we've both been blessed in many ways is having amazing mentors and having wonderful leaders here at CMU. So the dean who recruited me was Professor Al Bloomstein, who was another legendary CMU.
I did a story with
professor.
him many years ago when I was reporting for KDKA.
Right.
So I knew Professor Bloomstein.
So Al and Professor Bill Cooper had recruited Al, and Al recruited me. So it was an interesting small world. Then Professor Mark Camlett, who went on to become the provost at the university for many, many years and was widely regarded as having had a transformative provostship. He was the dean that actually he was the dean when Rema did her program, right?
I reached out to him and I said, this is what I'd like to do. He's a health economist. He said, go do it.
There you go. I love it.
So, that's that supportive, collaborative,
certainly.
encouraging environment that, scholars need, at the key moments.
Well, and you
Of their
mentioned
trajectory.
the interdisciplinary aspect within Carnegie Mellon, which it
Yeah.
is legendary for. But I always give so much credit to the late Jerry Cohen and to Mark Nordenberg, who was the chancellor
Yes.
of Pitt.
Pitt.
In the mid-'90s, they sat down together and said, you know what, we're not competing. We're complementary universities, and we should encourage people to find each other and work together. It sounds like that's
Yeah.
become very real.
Yes.
Without a doubt. And Rema is a great example of actually having done that, where she actually went and spent time at Pitt as well. But I think Jerry was, an amazing person as well. I recall maybe 10 years into my, appointment here at CMU, having an opportunity to spend time with him. He had been trained in operations research. Which is it's basically applied mathematics and optimization, which is about how to improve systems using mathematics and computation, which is really what I was trained in as well as what Rema was trained in originally as well. So having an opportunity to talk to him, to learn about how he had, what his North Stars were, so to speak, in his career, which was about impact, influence, and getting mind share for the kind of work that you do. So I think CMU brings together a collection of really interesting elements, I think. One is amazing people, people who care, people who are supportive, people who are entrepreneurial. Second, I think this opportunity to sort of to think big and take on problems that actually will have an impact. In addition to doing work that is going to have foundational, be able to do something that's foundational on the science front, but at the same time think about work that will have impact. And I think being at a place like the Heinz College, which is home to both the School of Information Systems and the School of Public Policy, there's really an opportunity to do problem-driven research that you can sort of have this impact and influence and mind share, while at the same time making progress in science. And the last piece, I think, is the connection to the community, the region itself being the place where you can really engage in work that you could actually have the impact that I'm talking about. So I think all of those elements came together. And of course, one discovers it. It's not all packaged and given to you the minute you show up. But I think that's one of the things that you learn over the course of time. But it's also been, to Kanak's question, I think, a place that allowed for the opportunity to create new things. So, I was with many others, a founder of the information systems programs at Heinz. And that was done when Professor Mark Camlett was dean. And he was very supportive of that entire effort. And as we moved on, I think the college was created. And I must say that the Heinz, the family, has been hugely supportive. We've talked about the leadership of leaders like Jerry Cohen and Mark Rudenberg, but I think we should emphasize the role of the foundations.
Definitely.
Because the Heinz
It's more
College,
than just a name on the building,
Yeah,
right?
exactly.
without a doubt,
Yeah.
because the R.K. Mellon Foundation was what provided the seed funds for what is today the Heinz College. And you see that tradition continuing with their very significant investment in the science building more recently at Carnegie Mellon. And then the Heinz family, right? In 1992, we became, from the School of Urban and Public Affairs, we became the Heinz School of Public Policy and Management, when unfortunately the senator died in that unfortunate accident outside Philly. And then Mrs. Heinz was supported the evolution of the Heinz School to the Heinz College in 2008, when we became the Heinz College of Information Systems and Public Policy, and I was appointed dean in 2009. So I think when I talk about the engagement of the community, I think the community in turn has been very engaged with CMU. So I think the foundations are but one example. I think the county government, the multiple not-for-profits that we work with, and we just talked about BNY Mellon, where your son works. I think these are all examples of organizations, be it Highmark, AHN Highmark, be it UPMC, be it BNY Mellon, PNC, which has a large center for financial innovation on campus. I think there's been this tremendous ecosystem that has existed. That's what when I mean community, I mean that in those broad terms. And I think, so it's a special region, a special place, and the university is special for all the reasons we've been talking about.
Well, and one of the interesting things, having lived here for 40 years, but told the story, that whole time and look back at it, I think people forget how strategic Pittsburgh has been really over the past 80 years. Because it was back during the Second World War that they started to be concerned about there might not be a steel industry someday without the stimulus of the war effort. And literally somebody wrote way back then, we should begin investing in our universities today so that they will invent an economy to replace steel just in case it ever went away.
Which is what the AI healthcare is doing.
Well, and that's
right?
and that's what they did. And so, right after the war, they built Pitt, a new medical school, and began to plant the seeds for Jonas Salk and everything that happened since. A decade or so later, they merged Carnegie Tech and the Mellon Institute to create Carnegie Mellon. and started the university down that path with artificial intelligence and all the computer science. And here we are today with that visionary leader. So you talk about the community. This region placed an enormous bet in higher education and in those institutions to do what ultimately had to be done because the steel industry did collapse, in the early 1980s. So I wonder, so here we are today, doing groundbreaking research, world leader in so many of these disciplines. Since this is a Biobeat show, let's talk about what's happening in health informatics. It sounds like it's a relatively new, discipline and industry and everything else. Yeah.
Actually not. It goes back a few decades too.
Okay, so it's been around.
Yeah, it's been around, and some of the early work was done here in Pittsburgh between Carnegie Mellon and University of Pittsburgh. When I started, when I moved into this area and finished my fellowship, Carnegie Mellon, because it is the medical school is a Pitt medical school. CMU doesn't have a medical school or a public health program. So by necessity, if you need to work in this space, you need to partner.
Sure.
So there was a need to go out and talk to medical centers and health systems and so on. And the point that Krishnan made about community partnership. The West Penn Hospital at that time was an independent, hospital.
Entity,
They reached out to our program and said, "Hey, we have an opportunity we want to train our residents in the evidence-based guidelines practice at the point of care." This was early 2000s, and we just want to build a database. And so they came to me and a colleague of mine. They said, "Can your students build us a database?" And we said, "It's not a database that you need. It's more than being able to deliver recommendations to the clinician at the point of care so that you can do the right thing for the right patient at the right time while they are there with you."
Sure.
So that partnership, and so the hospital, the health system worked with us for 2 years, building out an entire solution. We implemented it in the hospital, connected it to all the hospital, the admissions, discharge, transfer, information systems, and so on, collected the data. Ph.D. students got their thesis. We, that was really
It's a win-win for everybody.
Yes, and so the idea that health systems in the region were open to these types of partnerships, working with academics at a university, bringing students on board and giving all of us the time and the knowledge, their clinical knowledge and our technical knowledge, bring it all together to create a solution that actually worked well for patients, was really my first introduction to this nexus of informatics, IT analytics, and then delivering it for improved patient care. So that was a wonderful learning experience. And from there, it was establishing partnerships with UPMC, with AHN, and I think there's a lot of activity going on at this interface now.
A wonderful willingness to work together, here in the region.
So we just, Rama and I, we just hosted a AI and healthcare symposium, and thank you for inviting me to be a co-chair. I never expected it.
Oh, it was
a
wonderful
experience. I was just happy to put it together and follow you along.
A great experience.
Did you? Yeah, we had great speakers.
We had great speakers from all the institutions around. UPMC, Carnegie Mellon, Pitt, then
and we
AHN,
had the 2 deans.
And the 2 deans had a fireside chat. Dr. Shekhar and Krishnan had a wonderful fireside chat. And the topic was really both the opportunities and challenges that artificial intelligence raises.
With Karen Feinstein.
And Karen Feinstein, Dr. Feinstein of the Jewish Healthcare Foundation moderated that discussion.
Right.
And Jewish Healthcare
Forum.
Foundation, has been a great supporter also of healthcare initiatives in the region, and particularly in the areas of patient safety, women's health, and a number of other initiatives. So,
and you focus on health literacy. You want to take that forward.
Right. Yeah. And over the years, yes, though my focus in the for a long time has been in clinical and consumer health. Doing predictive analytics, prescriptive analytics, and so on. Over the past few years, I've really become passionate in the area of health literacy. The idea being that, we can create all these great tools and so on to work with, but if patients and consumers and the public are not ready to receive that information in the right manner, act upon it, then we don't really leverage get the full potential of all of these solutions that we are creating. So I'm also working on developing what we call digital therapeutic solutions for health literacy for both adults as well as for children. For children, I have a project with Children's Hospital of Pittsburgh evaluating gamified mobile health application for informing and engaging children with type 1 diabetes on nutrition literacy, physical activity, health hygiene habits, and scaling up to mental health, and so on. And we are actually conducting a randomized clinical trial at this time.
May I
that
ask a
group.
question, Rama?
Sure.
Since women, largely take care of family health, do you think they can make a difference in terms of your literacy drive? I mean, can they participate to use the knowledge you're creating to help take care of their families?
I think these tools are can be applied in a variety of settings. It can give information to women to manage healthcare for the family. It can educate children on as they grow up about basic health knowledge to improve their own healthcare decision making abilities, and the public in really during COVID, the pandemic, we got a sense for how limited perhaps is the information out there, and being able to critically evaluate the accuracy and timeliness and so on of that information. So we need to be prepared. And so these solutions that we are developing, the intent is exactly that, to really help the individual and the patients and the public in obtaining what we call personalized, just-in-time, contextualized education. And so if I want to learn about diabetes at this time, is there a way I can get accurate information from credible sources that I can really understand and then learn from it? So that idea, solutions, technology solutions that will help us build those types of capabilities is one of my focus areas.
And so we can have the STEM education in that pipeline,
Sure, you can include
learning
it. Yes,
and then include them
these
in
tools
that.
can be applied in that setting too.
So especially women, and you're a great role model, especially being an engineer yourself. How did that happen? Because it's not often that parents encourage girls to go into engineering, right?
Oh, there are a lot of women engineers out there who are doing great.
Well, it's changed a lot probably since you got into the field, right?
Yes.
Many
Not
more.
really,
Many. You don't think so? You think women are
it's
still
a minority? Not at Carnegie Mellon, but in other places. What do you think, Dean Krishnan?
Well, actually, you're right. At CMU, certainly it's 50-50, actually.
Yeah.
And it's been a remarkable story both in engineering and in computer science and in information systems, which is actually one of the majors that we have at the Heinz College and at the Dietrich College at Carnegie Mellon. But the broader point you make about the need for giving students the opportunity to pursue whatever excites them, and STEM is certainly one of the areas. I think there's been certainly improvement over these years, but you're right that like when I went to
IIT Chennai,
IIT Madras, yes. There were very few women in my class. But now when I go back, I see that it's increased considerably. But I think there's lots more work to do in this area.
Definitely.
I mean, the opportunities are just endless. The challenges are the
there,
ones that excite us to be able to look at safety issues.
Definitely.
And
so AI, you're going to ask that question.
Well, right, and that was kind of one of the questions I had about AI. You can both handle this, but as you're describing this, I'm wondering where AI fits into this, and in your industry, but even more broadly. Is it just another tool in our technology arsenal, or is there something about AI that is going to be transformative in a way beyond other technology tools and solutions we've had in the past?
So the general consensus is it's a general purpose technology, meaning that it could have significant impact across the economy, across society, and therefore the expectation is that it will likely have significant transformative impact. I serve, as you know, on the National AI Advisory Committee to the President, and very much the view among policymakers, both here in the U.S., but I was at the UN General Assembly just a few weeks ago in New York. This is a shared sense that this is a technology that has very significant impact, and I think generative AI in particular, as you know, even those of us who were actively engaged in AI, when ChatGPT was released by OpenAI, people were surprised at the capabilities that were on display.
Well, and that, I did want to ask you about that because, you've been doing AI at Carnegie Mellon since the 1950s, right?
Right.
And all of a sudden, like 2 years ago, it was like this revelation that all of a sudden everybody's talking about AI. So what's different between the good old-fashioned AI you've been doing for decades and what...
It's really interesting you asked me this, Bill, because when I appear in front of boards, I sometimes get asked a question about, so AI is 2 years old. I said, no, it's not.
Exactly.
It's been around since the mid-50s. And in fact, as you have said, CMU is the birthplace of AI. And there was a meeting in Dartmouth in 1954 at which, when this phrase was coined actually by Professor McCarthy. So I think it's had a long history. It's had its ups, its downs. It's had its summers and its winters. When I was in graduate school, my thesis was actually using a technology called expert systems, which at that time had its day, and then was found not to be robust enough for the many applications that demanded certain kinds of capability that the rule-based expert systems were not able to surmount the challenges. And at that time, in the late 80s, early 90s, there was an AI winter, as we call it, that followed. But I think Professor Hinton, who just won the Nobel Prize winner, he was actually at Carnegie Mellon from 1982 to 87. And he was one of the pioneers of what was called a technology called neural networks. And he stuck with, despite winter come summer, come winter, he stuck with it. And I think in the early 2000s, you began seeing as compute capabilities increased and the amount of data that was available increased, that the size of these neural networks grew, that there was something called a scaling law, which is the larger the model and more the data, you could actually train the model, as in you can learn the weights of these models. And they began demonstrating capability that was far superior to other technologies. So I think we've been, since sort of 2008, 2009 timeframe, there's been this tremendous increase in capability of what are called deep neural networks. And then there was this paper in 2017 on what are called transformer architectures that came from a group at Google. So the academics certainly had read about all that, but when it was actually deployed in a way that in what was then ChatGPT 3, which is GPT-3 and the conversational version of it, which was ChatGPT, was released, people were amazed at that step, this big jump in capability between GPT-1 to GPT-2 to GPT-3, even though it was using a technology, transformer technology, that had been actually invented in 2017. So you're right that when it was released towards the end of 22, that it took many people by surprise. But I think in the couple of years that, there's been this tremendous pace of innovation and growth, not just with text, but with images, with data. And increasingly, you're going to see, these are all examples of what are called cognitive AI. That is, things that are digital. But you're beginning to see now the emergence of what are called embodied AI, which is this capacity of using AI in the physical world. In fact, there's a startup out of CMU called Skilled AI, which is now in the region here. It's really remarkable what they're
drawing
trying to do.
significant investment dollars to grow,
as you know
It's
from
about
the news.
time. It's
Yes,
about time
right.
that Pittsburgh and the region capitalized on all that stuff.
And then, of course,
here.
Duolingo is
Yeah.
headquartered here and is a AI company for as well. So I think what I just chronicled, I think, has been the emergence of AIs for specific applications to these foundation models, which are effectively trained without any downstream application in mind, with very large amounts of data, large amounts of compute. And so sustainability is a big issue now that people are concerned about because of the amount of energy required to train these models. But I think to your question about what is different from the previous generations of AI and the newer generations of AI, one I think is, models trained for particular use cases versus the broad AIs that are being created, the foundation models. The second, I guess, is multimodality. I mean, from text to image to video. And then because of the huge amounts of compute and data available, the capabilities of these models have improved significantly. It still has, you've heard the word hallucination enter everybody's vocabulary. It's a stochastic technology. But at the same time, I think the capabilities are such that you're beginning to see different kinds of applications of this technology in real problem solving. In fact, there is coming back to healthcare.
That's where I was going to go next. I was going to see what
there is
the
a startup,
implications in
a bridge that has come out of, in fact, Zach Lipton, my colleague who's from CMU, is the CTO of this, and Dr. Shivdev Rao is the CEO. And it's an interesting technology that is an ambient AI. It sits in on a consult between the patient and the physician, and effectively at the conclusion of that consult is able to transcribe the relevant part of the discussion you had with the physician, and the physician can then review it. She can review it, and then when she approves it, it can the material that has been transcribed can be appropriately entered into the electronic health record or into the claim system. And the argument is that this actually gives back physicians between 5 to 8 hours of what's called pajama time, which is time that they have to spend, at home, doing all of this work. So I think that's a great example of the use of AI to take on a task where there is a lot of friction. It causes burnout among physicians, and it's an example of something that gives back time. Makes physicians more efficient in the performance of their tasks. So that's sort of bringing it full circle back to something that we began with. Is there one, AI and its evolution, but what's a concrete example of AI? And here's one that is invented right here in Pittsburgh.
Yes.
Who monitors all these training that you talk about? How are the training that is being done? How, because there's so much deluge of data, and so how do you differentiate, and who does all these, make sure that the right stuff gets into the...
So I think you're asking a really good question from the standpoint of, how can we trust these systems?
Exactly,
so this is actually the area that I've been spending quite a bit of time on from an AI and public policy standpoint.
Sure.
I think the approaches have been really to try and think about this in three different ways. I think one has to do with industry-led initiatives that have come up with ways of describing these are called model cards or data cards, which are like descriptions of what they do. Now, arguably, they're not detailed enough because these firms are trying to sort of protect their intellectual property and what it
Sure,
is they've
sure.
actually put into.
Yeah.
But at the same time, there is a desire by downstream users for transparency, which is your point about what went into these. So
Yeah,
what you
yeah.
want ideally is things like nutrition labels. Like when you buy pasta sauce, you have something that says, what are the things that went into it, and these are called nutrition labels. And the
Yeah.
question is, are there equivalent nutrition labels for
Yeah.
AIs?
Right, right.
So there is that. And
Okay.
then there is public policy of the sort that, Governor Newsom was recently in the news about having signed 17 bills and having vetoed one. And we have an executive order that President Biden signed in October, and then the National Security Memorandum that just came out just under a week ago. So I think there are executive orders that are going to govern how AI is going to be used by federal agencies. There's a very detailed report by the Office of Management and Budget. It's called the M Memo. And then there is law like what California has passed, which makes some requirements about disclosure. And in particular, the exec order and the California legislation, what the exec orders are saying is if it's a model that has required more than $100 million to train, or is larger, has required more than 10 to the 26 flops, which is large amounts of compute to create, then it has some special characteristics. From a national security standpoint, you need to have certain kinds of testing and evaluation by the Commerce Department and the AI Safety Institute. So there is that. Now the EU AI Act is probably the one very well-formed piece of legislation that gets into some of the disclosure requirements and some of these assessments. So it's a long answer to your short question of who monitors this.
Yeah.
In some cases, it's industry-led.
Sure.
In other cases, it's policy required.
Yeah.
It's still an evolving situation. It's not fully laid out. I think the National Institutes of Standards and Technology has played a very important role. And they've created something called the AI Risk Management Framework. And 2 weeks ago, we announced a joint center with the National Institute of Standards and Technology
Are you
at
going to
Carnegie
be
Mellon.
leading the?
I will oversee the research in that particular center.
Oh, wonderful.
Excellent.
Excellent.
And one question I had, Rema, I do want to ask. I'm going to ask you to kind of wrap things up and paint a picture of the potential in your space, right, in health informatics and healthcare and how this intersection of. But first, my one question to just build on what you were just talking about is, how well equipped are universities to really do the necessary research to understand this space? Because it costs so much money to buy the compute.
Yeah.
Where do you get
the energy costs?
And the energy costs and
Yeah.
everything else. So is this all going to be something that's going to get decided by enormous global technology companies, private businesses? Or will academics still have an important role to play to make sense of all of this?
No, I think this has been a major cause for concern. I think if you look at looking back at what's made our nation a leader in research and then innovation and being able to take that innovation to market, it has to do with the fact that we've had a very broad engagement in the innovation process. And that has typically involved academia in addition to industry. And today I think we have a situation where a small set of firms have both the compute and the data required to engage in this research. Now, I'm happy that these large firms in the main are American firms, but long run, this is not a good situation. So I think the National AI Research Resource, it's called NAIR, was explicitly created as a policy initiative to provide small and medium-sized enterprises. We shouldn't leave them out of this as well. The innovation that happens from small and medium-sized enterprises, unions, the worker voice, and at the same time academia, to have access to compute, access to data, and access to talent. Those are the three inputs you need: compute, data, and talent. to actually be able to take advantage of this innovation. So I think the NAIR is our current best public digital infrastructure, if you want to think of it that way. Think of it as digital public goods, as an investment by the government in public goods that become then a resource for universities, for small and medium-sized enterprises to actually engage in innovation. The first set of pilots were overseen by the NSF, and they've gone quite well. I expect in the next cycle there'll be another $30-40 million directed towards an air. I think we need a lot more. So I think this broader point you make about the need for innovation I think innovation needs to be more democratized, and that requires access to these three elements. To the last point about education, I think it's again something that's not just the province of the research universities like Carnegie Mellon. I think CMU has played a very significant role in creating platforms to get community colleges engaged in the education and provision of skills to a workforce that will need to acquire new skills for an economy that will emerge where AI will complement work that humans perform, and in some cases substitute the work that people perform, and therefore there's a need for upskilling and reskilling at all different levels. And I think educational institutions of all sorts will have an important role to play.
So we'll stipulate that all this gets figured out, right? And if it does, when you look at your space and the potential, since this is called Biobeat, and we're talking about the potential of all of this in healthcare
and Ramaya is on
biotech,
board, the biotech
and you're on the board. Yeah, what do you see as the potential or the possibility as
Endless,
all of this
endless, right,
plays
Rema?
out here, especially here in our region, but more broadly?
Yeah, no, this is certainly, I think, a very exciting time for healthcare. And the opportunities that the whole set of technologies encompassing AI and machine learning and deep learning and operations research and in economics, because we need to figure out the cost of things as well. And this is a big issue for healthcare. I think there are certainly a lot of opportunities. But, healthcare is already one of the most regulated industries. And so it's not as much a free-for-all that you see in the tech industry or other spaces. So every development that you have, every innovation that you try to test, there are very strict requirements that you need to make, the ethics of it, the safety of it, the impact, the outcome measurement, all of that have to be very carefully thought through and evaluated before. I mean, like the phase 1, 2, 3 trials, that clinical trials we go through for drug development and approvals and so on. I think that in some sense sets it apart from other industries, online commerce and tech and so on, and then you have a very distributed set of stakeholders. There are providers on one hand, payers on the other, patients on the side, the vendors and the innovators and the technology solution producers, and then of course the regulatory mechanisms, the government, state and national health agencies and so on. So all these players have to come together and agree that this AI deployment and solution is actually appropriate. It's working correctly for the right person at the right time. So there are a number of additional requirements that we need to think about. And so I think that's where research, academic research is really stepping in to apply different perspectives, bring a lot of different lenses to the problem. Yes, the exciting developments, of course, the OpenAI, the ChatGPT, really made, causes excitement in the public and causes big acceptance. So now everybody is willing to talk about AI-enabled solutions for solving these types of challenges. but does it really work? How does it work? And who does it work for? Is it affordable? And how do we pay for it? What are the incentives that you need to put in place in order to get this technology to be utilized?
Absolutely.
Who's going to be responsible if it doesn't work as intended? And who's going to bear the cost of unanticipated consequences, right? So we are,
All good
looking at
questions
all
to
of
look
these
into, yeah.
issues, even as we are excited about identifying new opportunities to develop solutions, engage with the community and the partnerships to deploy and evaluate them. I mean, we need to keep these in mind.
Yeah. So,
May I?
sure.
Rama, during the conference that we hosted, we saw a lot of these use cases
Yeah.
come to life.
Yeah, right.
So as people more and more, they say, yeah, this is working, it's possible, then,
But we really haven't deployed them at scale.
okay.
We have done those with pharmaceutical,
Yes.
products
Yes.
and drugs and so on, but not
And in
with
pediatrics. that-
AI. Not
Dr.
with AI
Srinivasan, yeah.
technologies. As
Yeah.
yet, they are mostly pilot studies
I
and
see.
small deployments
Sure.
because there has to be an agreement
Yeah.
amongst all the
Definitely.
stakeholders that
Absolutely,
yes, this is
absolutely, yeah.
really a solution that will work.
This is all fascinating. Sounds like there's still many more questions than answers.
there are.
Definitely.
So what would
yeah.
you say? Final comment from each of you just to that young person who maybe is starting their academic journey in India or California or here in Pittsburgh. What would you say to them about the opportunity ahead of them in your areas and Pittsburgh as a place to potentially begin that journey or advance that journey?
I cannot think of anybody else but these two to be those spokespersons.
So I think this is like Rema said, a super exciting time. I wish I was back 18 and getting ready to
school.
start my undergraduate studies, because I think there's so much potential to really see, depending on what your passion is, whether you're interested in innovation, as in developing new tech, or as in having an impact in the world, be it in improving the quality of life of people or improving healthcare, or for that matter, thinking about how to offer better transportation. There are so many opportunities and asking the question, revisiting these problems that have been long-running, difficult, challenging problems, and asking, with this technology, can I now tackle and potentially have a breakthrough? Number one. Does the new technology itself create a set of challenges? And energy is one such problem. Oftentimes when you talk about AI is as much a technology that can help with climate problems or energy problems, but in and of itself, it creates its own energy problems.
Yeah.
And the issue is, how do we create
Solve that.
sustainable AI?
Yeah.
That itself could be an interesting problem. So
Challenging.
it's like being a kid in a candy store, right? There are so many amazing problems.
I'm ready to be a PhD student all over again.
You feel the same way, Rema? Is it just that?
I know.
endless opportunity?
Yes, it would be wonderful to go back to school again.
Yeah.
And one other thing I guess I would add is to be willing to be open to these new developments. This is a moving target. When we started our PhDs, we never thought about, OpenAI or ChatGPT or Google, solutions. So it is, even all the machine learning and then deep learning and now what we call these Gen AI, LLMs and so on. So, the students who come in, I really encourage them to be open-minded, to get all the skills that they need from all these different perspectives.
Interdisciplinary,
Because every problem, be it tech or finance or transportation or healthcare, you cannot just apply one hammer to solve these problems. You need multiple perspectives.
Absolutely.
So to build the skill set from all of these different, both disciplinary areas and application areas, so they are well-rounded and they are then prepared to take on the new challenges, the unknown challenges of the future. That's what I would recommend.
I love it. These are the questions we have today. We can't even anticipate what the questions
Questions
will
of
be in the future. Thank you both so much.
What an honor for me to host both
Thank
of
you very much for
and
having
look
us.
forward to having you again and with new ideas. And anytime you have something to say, just call us, and we'd be happy to come to your office and bring that to the attention of the general public.
Thank you very much.
And
Absolutely.
sow those seeds of interest that you talk about. Everybody should be excited as you are. So thank you
all right.
so much, Krishnan and
Thank you
Rema.
very much. And to our listeners, thank
And
you
happy
for joining
Diwali.
us. Happy Diwali, yes,
Diwali,
and
yes.
thank you for joining us
Thank
on
you very much.
Biobeat.